Our mission hospitals are overwhelmed with patients and don't have enough staff to get the job done. We're looking for people who have a heart for service, a heart for ministry.
It is my goal to help raise the next generation of physicians in places that are low-resourced and are in need.
People whose hearts are broken when they understand that people around the world are dying of diseases, and don't have adequate health care.
When I was in high school, I knew I felt called to missions. Seeing the hurt in the world, it was like confirmation. I can help be a small change in that.
As I moved along in my medical career, I knew that I wanted to be a pediatric surgeon and that I wanted to use that skill to teach pediatric surgeons in the developing world.
We are privileged to partner with an organization that has fought mission drift and has stayed mission true.
Just do a work in his heart.
The gospel is front and center of what World Medical Mission does.
The Samaritan's Purse, we're looking for those people that have been marginalized and try to help them and do it in Jesus' name.
World Medical Mission is a medical ministry of Samaritan's Purse. Our goal is to see the gospel proclaimed using medicine and medical ministry at our partner hospitals around the world.
Some of these mothers and fathers come so far just to get to these hospitals here, and it's so important that World Medical Mission is helping provide medical equipment and doctors so we can help keep these hospitals going.
Tenwick Hospital would not be the hospital it is today without the help of the World Medical Mission volunteers.
I've been coming to Tenwick Hospital for 17 years now. I have always come here with my family. A short-term trip repeated over a long period of time, especially the same place, has a tremendous impact. They feel that energy and that support and that love that comes from people who are coming repeatedly to provide them with some relief.
We have more opportunities, more needs than we have doctors. And not just doctors, physical therapists, respiratory therapists, nurse anesthetists, nurses. A variety of healthcare professionals are needed to serve at our mission hospitals.
There's not a day that goes by when I don't use something that was sent by Samaritan's Purse, a piece of equipment or even a catheter.
We have a team of biomed technicians to install new equipment and to make necessary repairs. If we're going to send people, we want them to have the equipment they need to serve.
My husband is an internal medicine physician, and I am a clinical pharmacist, and we have absolutely loved being a part of the post-residency program.
The post-residency program will help you go full-time abroad for 2 years.
Being here with my wife, who's a clinical pharmacist, has been an adventure. It's both of our first time living abroad. We get to collaborate on projects at the hospital, on patient care.
For us, it allows us to get onto the field quicker. It allows us to try it out as a family with our children. They feel like this place is home to them, which for us as parents is a huge win. It gives you the confidence that you can actually do this for long term.
It's evident these hospitals would be closed 10 years from now, 15 years from now, if it weren't for these young doctors that are giving their lives to the Lord in full-time service.
With our teaching programs here, we have the ability to pass on knowledge to multiple people. The knowledge of one doctor becomes the knowledge of many.
They thrive on whatever we teach. Like, they'll ask us, like, hey, Dr. Elena, can we talk about this? And so their passion fires us to want to teach.
I think that sounds good. I think that's a good plan.
Whether you're interested in short-term volunteering or long-term career service, there are many opportunities at World Medical Mission for you to serve. I can assure you the need is great.
If you feel the Lord's calling on your life, I would say go for it. Talk to the team, help them to know what you're looking for, what you feel called to do, and then hear from them about the places that you might serve.
We're all called to proclaim the gospel. We're all called to make disciples around the world. We're all called to serve.
This is why we're here. This is why we do medicine.